In this section, we're going to learn about the contents of semen and learn how physiologic an orgasm occurs. So, semen consists of two parts, the sperm and the seminal fluid. So when we look at seminal fluid, we can see it has the multiple components, the smallest component of which is going to be coming from the testes, which are where the sperm are originating. So 2/3 of it comes from the seminal vesicle. And the fluid from the seminal vesicle contains three things which are really important. The first is fructose, and fructose is the energy source that the sperm can be using, because remember, they are going to have to swim quite a ways. The second content that's important are prostaglandins, and these prostaglandins, once they are inside the female, are going to be causing some uterine contractions, which will shorten the pathway for the sperm to make pregnancy easier. And the third component are proteins that will be thickening the semen and also will act as a glue. So when the sperm are ejaculated, it will kind of like glue the sperm next to the cervix for a while the sexual activity finishes, so that they won't just fall back out of the female right away. The next largest component of seminal fluid comes from the prostate gland. And the two parts of this that we are concerned with is that there is an antiseptic component, and there's another protein, PSA, which actually is going to ungel the proteins coming from the seminal fluid. Now, this doesn't work until about 15 or 30 minutes later. And so what this does is it thins out the secretions so that the sperm can now swim and enter into the cervix and go up into the uterus. And the prostate gland accounts for somewhere between 25% and 1/3 of the secretions. And just around 1 or 2% of the secretions comes from the bulbourethral gland or Cowper's gland. And this is that gelatinous, mucousy substances. And what's really important is this has a high pH. It is alkaline. So this is small in volume, but it is super important. It's going to be, this is the gland that's closest to the penis, so it's what's going to enter the penis first. So it's going to be cleaning the penile urethra of any old sperm and any urine remnants in case there's a urinary tract infection. It's also, because it's gelatinous and mucousy, it is going to be lubricating. And the alkaline component is going to neutralize the vagina's acidity, because otherwise, when the sperm would be released into the vagina, they would die instantly. So when we look at the pathways, the sperm pathway is slightly different than the fluid pathway. And so the fluid from the seminal vesicle is going to join up with the fluid from the prostate gland, which is then going to join up with the fluid from Cowper's gland. And that's then going to account for between 95 to 98% of the content of semen. And the other 2 to 5% is accounted for by sperm. And so all together in an ejaculation, you could release up to 500 million sperm, but realistically, you're not going to, unless it's been a while since there was an ejaculation. But here's the thing. A lot of men are worried, if they get a vasectomy, that the woman somehow will be able to tell. All right. If you get a vasectomy, the only thing that changes is that there are no swimmers. So it's all fun, no seeds. Okay. So there's no way to tell that you're missing 2% or 3% or 4%. Okay. The rest of the fluid is still there. All right. So let's talk about orgasm. So to have that good sex life, there's going to be two parts to it. You have to have the erection, then you have to have the ejaculation. So to understand the erection, let's go back and look at what that penis looks like. So on the amputated penis drawing versus the actual photograph. In the photograph, you can see it kind of looks like a monkey's head. So here where the mouth is, this is the penile urethra, and it is surrounded by a cylinder of erectile tissue. You can see it kind of looks like a sponge surrounding it. So there are spaces that are going to be filling up with blood. And then we have two much larger cylinders of erectile tissue, which actually have a fairly significant artery in the middle of it. We also have arteries here in the penis as well. And these other cylinders, notice they have even larger spaces that can fill up with blood. Now notice the veins in the penis are very superficial up here on the dorsal side. So as these cylinders fill up with blood, this is the part of the penis that's going to enlarge. And so it's going to be getting larger and smooshing and pushing against those veins. And remember, the blood pressure in the veins is lower than the blood pressure in the arteries. So it's actually going to be collapsing the lumen of the veins, thereby preventing blood from leaving through the veins. All right. So let's go through this step by step. When a man becomes sexually aroused, there is parasympathetic stimulation. So number one, the penis contains no skeletal muscle, none whatsoever. So there's no somatic motor activity going on. The blood vessels in the penis have smooth muscle. So everything relies on the autonomic nervous system. And so with sexual arousal, the first thing to come into play is parasympathetic stimulation. And with parasympathetic stimulation, what comes into play is the release of an amazing compound known as nitrous oxide. And nitrous oxide release causes the production of something called cyclic GMP, which is a high energy compound, kind of like ATP, but totally different than ATP, but kind of like ATP. And what cyclic GMP is going to do is cause arterial smooth muscle relaxation there in the penis. So nitrous, not nitric oxide, not that stuff you can inhale, but nitrous oxide is the most potent vasodilator we have in our body. And where we have it is in the penis and clitoris, but in the penis with parasympathetic stimulation. That's releasing nitrous oxide. That's giving us arterial vasodilation. So the smooth muscle on the arterial in the middle of these erectile bodies, that's dilating. That arterial is increasing its diameter. So as it increases diameter, that means more blood flow is going to come in. So the erectile tissue, which was here in the limp penis, is going to fill with blood. It's going to compress the veins here on the surface of the penis, and that's going to cause the erection. All right. So what happens if you have erectile dysfunction or you're impotent? Well, the erectile tissue could partially fill, and maybe you don't have enough to compress the veins, or maybe you can have an erection, but it's very short-lived. There are a lot of medical reasons for this. Vascular disease, if you've got high blood pressure, hardening of the arteries going down in your pelvis, so you have decreased blood supply to your penis, you're not going to have your normal response. If you've got diabetes, that's a small blood vessel disease. If you have a problem with with the nervous system, whether from a spinal cord injury or multiple sclerosis, if you've had surgery in the area which has interrupted the nerves to the area, a few endocrine disorder. In other words, there's a plethora of reasons, but the most common are going to be vascular diseases, especially high blood pressure, peripheral arterial disease, and diabetes. Those are going to account for about 75%. Throw smokers in there because remember, smokers have vasoconstriction, which is the opposite of what you want to get an erection. Okay, so this is not just a disease of elderly men. By the time men reach age 30, almost 20% of men have erectile dysfunction. Age 40, 30%. So you can see by the time you're in the 60s, 60% of men will have erectile dysfunction. So it's extremely common. For some of these rarer causes, people need implants of surgical devices, but for most gentlemen, the way to treat erectile dysfunction is to take the little blue pill, Viagra, or to take Cialis. What these medications do is they inhibit the enzyme that's breaking down the cyclic GMP that was produced by the nitrous oxide from the parasympathetic stimulation, thereby giving a full erection and an erection that lasts longer. All right. But as we know, an erection is only half of it. We need to go to ejaculation to finish the orgasm. And in the ejaculation, we're going to take the sperm that are hanging out here in the epididymis. So this is a tubule in the epididymis. This is not in the testes, it's epididymis. And notice the sperm are hanging out in here. If they're not called to duty, well, this is where they die through that process of apoptosis, the pre-programmed suicide. But if they're called to duty, the way they're going to be called to duty once again is going to be through the autonomic nervous system, but this time it requires sympathetic stimulation, not parasympathetic stimulation. We need muscles to contract now. And the muscles that are going to be contracting are going to be the vas deferens. So the vas deferens, when it contracts, is going to have peristalsis, just like you had in your digestive system and your urinary system. Well, guess what? The male reproductive tract has peristalsis too. And peristalsis in the vas deferens is very strong, so strong, in fact, that it's going to be sucking the sperm out of the epididymis. And the glands, those three glands we talked about, the prostate gland, the seminal vesicle, and the Cowper's gland that have the secretions, they're going to start releasing their secretions as well. Okay. Once seminal fluid is in the urethra, these rhythmic contractions of the vas deferens are going to be causing ejaculation. So everything is peristalsis of the vas deferens. Okay. Note, sperm are lazy. They're not swimming while they're still inside you, right? Because that would take energy and they would need an energy source. Their energy source is the fructose coming from the seminal vesicle. They're going to use that once they're outside the body. Okay, the pleasure sensation that you get with the orgasm comes from your brain, specifically your limbic system, that pleasure sensation, and your cerebral cortex, so that you are aware of it. Now, the total ejaculate, I know it may seem like it's half a cup or a cup. It's actually a teaspoon, 2 to 5 cc's. It's not that much. And in that 2 to 5 cc's, there's only 100 to 300 million sperm. Okay, ladies, it only takes one to get you pregnant. So men, it's a very wasteful process. less than 1%. Like people talk about how many oocytes the woman makes. Man, you're making many more sperm than how many you need. Why are you making many more sperm? Because a lot of your sperm are defective. That's why. Okay. So here's what human sperm look like. I know we always talk about how they got the little pointed cone heads, streamlined for swimming, and I want you to realize that a lot of them really aren't that cone head. Yes, they're rounded, but they're really not that cone headed. The other thing I want you to realize is be careful where you are ejaculating because the average speed of an ejaculate during orgasm is 28 miles per hour. Do not ejaculate into somebody's eyes because that can cause major trauma. And you're going to have to explain that to somebody in the emergency room. Okay? And you may have to explain that to somebody's parents or loved ones. So just think about that. All right. So when I talk about malformed sperm, here's drawing showing examples. Sometimes the head of the sperm is big, sometimes it's tiny, sometimes they're two-headed, sometimes they're two-tailed, sometimes the neck is weird. Anyway, all kinds of things can go wrong with the tails. And I didn't even show here, like we can have curly tails, we can have round tails where they just go in circles, we can have short little tails, we can have super long tails tied in knots. All right, so over the lifetime, the man's going to make trillions of sperms. He's not going to have trillions of babies, no matter what his name is. Okay. Many are going to be abnormal, especially if you're a smoker, and there's a lot of diseases that lead to abnormal sperm. And here's the thing, men, we always talk about as women age, they have all these mutations. Men, the mutations happen 4 times faster in you than they do in the women. All right, that's it for this section. Come on back and I'm going to actually talk about the formation of the male gametes, how we form these sperm in the next section. So thanks for all your hard work and I'll see you shortly.